Okay, so our next guest says neuropathy doesn't just affect thousands of people in the U.S., it affects millions, and many of them don't know that it can be treated. Dr. Matt Thomas, board certified in neuropathy and the founder of 360 Neuropathy, joins me to talk about his neuropathy treatment. Hello, Dr. Thomas. Thank you for coming in.
Hey, Hannah. It's great to be back on Good Morning Texas. Thanks for having me.
Of course, we always love it having you on. I think this is really important information. We've talked about peripheral neuropathy before, you and I.
Sure.
But what happens when a person has neuropathy? How do you describe that if folks don't know?
Well, when someone has neuropathy, the peripheral nerves are damaged. Now, the peripheral nerves are the nerves that come off the spinal cord controlling the arms and hands, as well as the legs and feet, as well as other tissues and visceral organs. Now, when these nerves are damaged, they're going to send a signal to the brain that translates into pain. So numbness, tingling, electric shock-like pain. Typically, these start off slowly and then gradually increase over time, especially for people who have metabolic conditions like diabetes. But for people who have chemical-induced neuropathies like chemotherapy, Agent Orange, or certain prescription medications, it can really happen very, very quickly.
We want to know, I think this is really important because it impacts people in such a way, their quality of life. This is something that can be treated, correct?
It can absolutely be treated, but most people who suffer from neuropathy have relied on prescription pain medications for way too long, and these don't do anything to address the cause. They simply treat the symptoms, mask and manage the pain at best. You have to discover what the cause is. You have to discover what the severity is so that you can treat appropriately. Typically, people who have neuropathy, you've got to stimulate the nerves to grow. You've got to increase blood flow so that you can get oxygen and nutrients into the nerves themselves. And then the nutritional deficiencies that people have, unless you address those, you're never going to correct the problem fully.
So really going at this issue at the source. So question, people watching right now, how would our listeners know if these treatments would work for them?
Well, every new patient that comes into our office, we do a thorough evaluation. So our neuropathy exam is very, very thorough. We can calculate down to the percentage how much sensory loss a person has in their hands or feet. We don't use any drugs, injections, or surgeries in any of our treatments. In fact, we use only the latest FDA-approved non-surgical means for reversing the damage caused by neuropathy.
I think for anybody suffering from this, I've talked to patients in the past, it really just totally takes over your quality of life.